Hello, everyone, and welcome to another episode of The Relay, the official podcast of the National Transitions of Care Coalition. And I'm your host, Val Emmons. So, every patient transition presents unique challenges, but few are as complex or as life changing as the journey through organ transplantation. From evaluation and waitlisting to surgery recovery, lifelong medication management, and ongoing coordination across multiple providers, transplant patients depend on seamless transitions and exceptional communication. That's where case management becomes indispensable. And today we're joined by someone whose career has been dedicated to improving patient care while advancing the profession of case management itself. Janet Coulter is my guest today, and she's a fellow of case management, a board certified transplant case manager with a large health plan, and currently serves as president of the Case Management Society of America. Although I think she just handed that reign over to someone else in June, so that might be wrong, but I'll let her clarify that. But throughout her career, she's been a nurse educator, administrator, team leader, director of case management, author, a mentor, and a national leader. And her journey began with a childhood dream of becoming a nurse and evolved into more than 2 decades of leadership, helping shape the future of case management. So today we'll explore the unique world of transplant case management and why care coordination is so critical for these patients and what the future holds for one of healthcare's most essential professions. Janet, welcome to the relay.
Oh, thank you, Valerie. I am so happy to be here. Thank you for inviting me.
Yes, ma'am. So I've known you for years, and you've always said that you knew from childhood that you wanted to be a nurse. Looking back, what's the first thing that inspired that passion? And how did it ultimately lead you into case management?
Well, actually, as a child, I had surgery like 5 times, and I was in the hospital many times. And that's why nurses became my role models because I was in the hospital so many times. And actually, when I went to nursing school, my pediatric nursing instructor had also been my nurse when I had surgery.
Oh, wow. So, with that, when you said you spent nearly 2 decades yourself as a nursing instructor before transitioning to case management. So, what lessons from that role in teaching have stayed with you throughout your career or what are some of the memorable things that you can talk about in that aspect?
I think from being a nurse educator, I also have a master's degree in adult education. So, using the principles of adult education when you're working with adults is very effective.
Oh,
Uh,
yeah.
you know, like when you're teaching grade school children or high school children, you teach it a little differently. But when you're teaching adults, it's a whole different perspective and a whole different way to approach things. And I think that has been most beneficial for me.
Well, and I think that's one of the things that we're now starting to understand with that. That's a social determinant of health.
Absolutely. Yeah.
So, but many nurses, they may not fully understand what case management actually is. So, how do you explain the profession to someone who's never experienced it?
Oh, that's a really hard question. I'll tell you. To me, case management, it is really, to me, case management is looking at the patient, looking at their proposed treatment, and trying to help them get the treatment and the medication that they need and the education that they need to be as healthy as they possibly can. So you want to look at the social determinants of health. You want to look at, especially their environment. Can they afford the medication? Can they afford to see the doctor? We'll look at all those different aspects and kind of roll it into one. That's the way I see the role of a case manager.
I used to work with you at the Case Management Society of America
Yeah.
with Sherry Latimer. And I'm telling you, whenever I first took that job, I had no idea what a case manager was. It took me it took me a few minutes. I mean, more than a few minutes. It took me a while to figure it out myself, and then I got thrown into the in-talk role, and I was like, "What in the world is transitions of care?" Because I wasn't clinical. I was just, you know, uh, my background is policy and communications, so I had to learn those things. But over the years, I mean, from listening to everyone and all of the horror stories and the good stories, I think I've become pretty well acquainted with both, and it's been a journey actually watching case management flourish from being something that no one actually knows what it is. The same with transitions of care. But, you know, you often describe case manager is something you were hooked on immediately. What was it about that role that resonated so strongly with you?
Well, I like to help people. I'm a helper, and, I like to help people and see them become better, whether it's physically or to better deal with, what's happening with them. So, I'm a helper, and I like people, and I like to talk, and I like to talk to people. So my
And it's
role as a telephonic case manager is perfect for me because I get to talk to people all day.
well, and I would think that people it's a puzzle too because you're having to constantly, um, figure out how to help people.
Right, trying to find out, are they are they really because 'cause I'm telephonic and I have to go on, what they tell me and what the doctor writes and tells me. And, like one patient I had, I was trying to help him lose weight because he was really obese and his blood pressure was up, his diabetes was out of control. I talked to him every couple of weeks and we talked about his diet, his medication. He assured me that he was following his diet and he was losing weight. So after a couple of months, he said, I'm going to the state fair. I'm going to be in this tractor pull thing and I want you to watch it on YouTube. So I
Huh?
watched it on YouTube and he had not lost any weight.
Oh,
He just told me what he thought I wanted to hear on the phone. So you have to be, you have to make sure that what you tell them is realistic and that they're really kind of following through. And if not, how can you help them with with that?
well, I think that's interesting because, you and I both went to the Hill many numerous times to push telehealth.
Oh yes.
Before it became a thing after COVID, I'm pretty sure that that's how they knew about telehealth because we gave them over pamphlets and all kinds of material all of the years that we went to the Hill to talk to them about it. But I guess that's one of the things that we didn't think about was weight management and how are they going to lie about things like that.
Yeah, we had some great times on the hill. That was a
Yes, we
wonderful
did.
experience. Oh my
Yes, we
gosh.
did, and we did. I mean, look what we did. I mean, that just proves that you can make change. Um,
Absolutely. Yeah,
because I don't think that if we wouldn't have went to every year and talked to this, the staffers and the members of Congress, then they wouldn't have known what to do during COVID with
yeah.
telehealth. They wouldn't have known.
I think we made a
Um,
big difference.
I think so too, and I'm proud of that one. Right now, your focus is on transplant case management, and I find that fascinating. And for listeners who may not be familiar with this specialty, what does a transplant case manager actually do?
Well, let me give you a little background. 8.5 years ago, well, 9.5 years ago, my husband was diagnosed with NASH, which is non-alcoholic steatohepatitis, which turned into cirrhosis.
Oh,
So 8.5 years ago, he was so lucky and received a liver transplant. So lucky. And after he got his transplant, and I was his caregiver, and after he was stable, then I realized, I used to do workers' comp, but I think I would rather do transplant case management because that way I can help people get through the process so they won't be as scared. They'll have more knowledge and know what's going on and what to expect. So that's why I transferred to transplant case management. So my role now is I work with people who are being evaluated and trying to get on the transplant waiting list. It's a long process. There's a lot of diagnostic testing. There's education. Patient needs to prove that they have a caregiver 24/7 for a couple of weeks after transplant, and that's hard for some people that they
yeah.
can't find someone that will commit to that time thing. They
Oh,
also have to make sure that they have the financial backing, so I look at that from an insurance perspective to make sure they have insurance coverage, and, another interesting thing I found is, when you get your insurance through your employer, which most of us do, you don't check to see if you have transplant insurance coverage because unless you know you're gonna have a transplant,
that's
and
true.
sometimes then when you check, you either don't have transplant coverage or you've got really not good transplant coverage. So that's an obstacle I try to help people overcome too. Then the other thing that the patient has to commit to, and that is compliance. They demonstrate that by being compliant with all the doctor's appointments during the evaluation, taking their medication, following directions, and those things. So, as long as they pass all the physical parts and those three things, they have a good chance of getting on the wait list.
That's a
So, I
lot
have
of moving parts there because I mean, because transplant. patients often see numerous specialists, like you just said, hospitals, pharmacists, laboratories, community providers. How do you become the thread that connects all those pieces?
It's not easy, but, there's about 100 people that will assist people that will help with this transition of care for this patient from being not on the list through being on the list, having a transplant, and then post-transplant. So there's like 100 different people that touch this. So it is a complex maze sometimes.
Well, what do you see the biggest risk for transplant patients during transitions? Because that's our mission here at InTalk. And between transitions and then between those care settings, what's the biggest risk for transplant patients?
I think the biggest risk is, of course, infection and then not being compliant with their medication. I
Mm,
had a 12-year-old that had a bilateral lung transplant. He had been ill most of his life and he was lucky enough to get a transplant. And so his parents, after he recovered from the transplant, allowed him to be in charge of his medications. Well, he's feeling pretty good. He's gone back to school. He's participating in sports. He's happy. He's got friends. And then they noticed he was showing signs of rejection because they later found out that he had stopped taking his medication. I mean, why take your medication? He feels good. So why is he taking that?
right.
So that's a problem with a lot of patients. The cost of the medication, the immunosuppressives post-transplant can be inhibited for some people also. I will tell you that after my husband's transplant, he contacted Crosby from the musical group Crosby, Stills and Nash. Yeah,
Right.
I go way back. I'm a baby boomer, but anyways, Crosby had a transplant, and my husband contacted him on social media and asked him, "What do you recommend? How should I do this, post-transplant, blah, blah, blah." And Crosby answered back and said, "Whatever you do, don't your medication. Be sure you take all your medication."
Right.
That was a big incentive for him. And, the medication is a major part because 'cause they're gonna be on that the rest of their life.
Yeah,
Yeah,
I mean, and I guess that people don't understand that because it's a lifelong, like, immunosuppressive therapy and things of that, and there's probably a lot of barriers. I mean, think about that. If this child is 12 years old, he's got the rest of his life, and lots of things are gonna happen to where he might forget or doesn't have the money for the treatment. That's a hard obstacle.
yeah, it is. It sure is. And you have to remember that transplant isn't a cure, it's just a treatment.
Right,
So,
right.
if people look at it like it's only a treatment, it's not a cure for what happens. Like, for example, with what my husband had, non-alcoholic steatohepatitis, he could get that again with his new liver. So he has to
Wow.
be careful with, what he eats and that type.
So, behavioral health is also an issue, and then we've got, of course, we talked about the financial concerns, transportation, then you've gotta have caregiver support for probably a while, and
Yeah.
then health literacy, that all influences outcomes. How important is addressing those social determinants of health alongside that clinical care? Like, how hard is that to make patients understand, like, "You gotta be at this appointment, you gotta get this medication," and when they have maybe a behavioral health issue as well?
Yeah, that is a major concern, and one of the things I've found to be most effective is to also have contact with the caregiver. So the caregiver can also intervene and make sure they get to the appointments, especially with liver disease patients, because once that disease progresses, their cognitive function isn't as good, and they forget things and they can't think as well. So they need that support person, that caregiver to be behind them to make sure that they take their medication and that they actually, go to the appointments and they get the blood draws. Because that's another thing that is a problem post-transplant is they have to have blood draws ever so often. Right after transplant, it's like a couple times a week. And then as the years go by, it's like maybe once a month or once every 3 or 4 months. But that's something they also have to be compliant with, is getting their blood drawn.
I mean, I get that because it's kind of like you once you start feeling good, it's kinda like when you're on antibiotics, you start feeling good, you forget to take that last couple of antibiotics, so,
That's
I
right.
mean, I can understand where they would forget, but I guess that's really important for them to remember that, but
Yeah.
so
You
you've
know,
been working in this for, like, 8 years, and when I knew you, you were in, workers' comp, but how are, like, telehealth and technologies evolving to like, we have patient portals now, digital tools. How's that all changing for case case management and, and transplant case management?
Actually, we use, AI some for, like, to record our calls,
That was my next question.
yeah, and it's really nice because with that, I can focus more on the patient and not taking notes and trying to remember what all they said. So and that works really, really well. But yeah.
So where are the places that AI is helping case managers and, not just the transplant, but case managers in general? And where do you believe that the human relationship, I don't think that can ever be replaced, but I think that there always has to be some human aspect to that. And I hope it seems to be the thoughts of the community as a whole.
Oh, we need to keep that human element in there for sure, for sure. Now, I do see I doing some of the utilization management that involves in your transplant, like looking at the approval for the transplant evaluation or the approval or the certification for the transplant. But we still need that human touch to look at that to make sure they've covered everything. Because I've read, although I have no experience with it, but I've read that because they're using AI some places in that there's now more denials because they haven't had that human touch.
Oh,
So
wow.
I think we still need to have that nurse input and physician input into requests for treatment, especially when it relates to transplant, because there's just so many different pieces that you have to put together.
I mean, that's crazy to deny somebody. I mean, what are the criteria for that?
Well, I've never denied anyone a transplant because before it ever got sent to physician review, I made sure we had all the pieces in place. And another thing is to remember is that everyone doesn't want a transplant. I've had some people
Yeah.
that, I don't think I want a transplant. I just want to do what the treatment is and live my life. So that's something that we have to respect is that some people don't want a transplant.
I think it's hard sometimes that's hard for the caregivers, though, because they want their loved one to be with them forever, as long as they possibly can, and when someone refuses, how do they handle that whenever the patient doesn't want they just want to finish out their life and deal with it in that aspect? I think that's hard.
I think that'd be really hard because I know I wanted to do everything I could for my husband. But I will tell you that the role of the caregiver is something that's definitely overlooked. And the caregiver is so important in the transitions of care and to make sure that the transplant goes, they're not the organ's not rejected the caregiver, for the next maybe 2 to 3 weeks, 24/7, they're taking care of that patient, making sure they eat, they do their physical therapy, they get their medication. I know with my husband, it was like we got up early, had to check his blood pressure, his blood sugar, all that, and record that, and I fixed his breakfast, he took his medication, we did a little physical therapy. "Oh, time for lunch." So I
Right.
fixed his lunch, then, "Oh, time for the 1 o'clock medications." A little physical therapy, take a nap. Now it's time for dinner. So in between that time, I would try to do what I had to do, like, housework, wash dishes, that type of thing, go to the grocery store. So it's one thing we don't want to forget about is the caregiver. They are so, so important in this transition so that the transplant patient's well taken care of and they get their medication, they get to the doctor's appointments. I
Yeah.
really try to enforce that a lot when I'm talking to the patients and the caregivers that the caregiver has to take care of themselves so they can take care of the patient.
Are there any particular apps right now for caregivers in regards to, I mean, case management or even transplant case management? And specifically, are there any AI apps that have been added yet, or are they just not a thing yet?
I don't know, but I will say that one thing that I like to be sure the advice I give to caregivers, if somebody offers to help you,
Hmm.
people might say, "Oh, if you need anything, give me a call." Well, that may not be really what they mean. I'm going to the store. Do you know anything? Yes. I need this, this, and this. Even if it's just a few things, because that helps you and that helps the person that's the giver, the one that's going to the store, because then they feel like they're really helping you. Or, could you pick up a prescription for me? Could you return my library books? Just little things that kind of build up that just a small thing someone could do for you that will make them feel good and will also help you.
It's hard for people to ask for help even when they're sick, you know? I mean, even when they're caregiving for somebody, some people just don't wanna ask for help or they don't know what to ask for at that moment. So, sometimes yeah, I get that, I get that.
Yeah, I agree because, I'm very stoic and I really didn't want to ask for help either. But then I realized, you know what? My friends really want to help me.
Right.
So, okay, I'll have them do just a few things. Not much. I don't want them to come and clean my house, although that would be delightful.
I mean,
But
I
but maybe run a few errands or just come and maybe sit and talk to my husband for a few minutes so I can take a shower,
right.
just little things like that. And that was very helpful for me. And later on, they told me they really felt useful and helpful, and they really enjoyed doing that too.
Yeah, because, people aren't always just saying, "Hey, let me know," just to say it. Some people are just honestly like to help others,
Yeah. Yep.
and sometimes you gotta let them.
Yep. Yep. There are some helpers out there, which is wonderful.
So, you've served in many leadership positions in every level, like from national to local chapters. What leadership lessons have shaped you the most along your journey?
I think the most is to listen to people and to try to nurture leadership in other people. I don't think the leader needs to be the one out in front. The leader needs to be the one that's nurturing other people to become leaders, to become writers, to become better case managers. And that's what I take away from it. I think the leader should also be a mentor.
I love that. And so, speaking of mentorship, it's been an important part of your career. What advice would you give a nurse who's considering transitioning into case management today?
I would say go for it. It's a wonderful position. And the way I see it is I've been training for this all my life. I worked on the floor for almost 10 years and I was a nurse educator for a while. And then I did workers' comp. And then I've also done just regular case management. But I could use all of that together to help me in my role now. I look at it as all my experiences have come together to really help me with the role that I have now, which is great.
And what are some of the biggest opportunities and the biggest challenges that are facing the profession of case management over the next 5 to 10 years?
Think one challenge is title recognition or title protection
Hmm.
because there are a lot of different things that say people that say they're case managers, which is why I always introduce myself as a RN case manager. Uh,
Right.
and I think title protection will be also a very big thing. And I think the influence of AI in what we do will also be a big
Oh,
influence.
huge. Yes, huge.
And we need to make sure that we still have that human element in there. Sometimes I've talked to people on the phone and so I think, boy, that's so clear. And is this AI or the real person? So I ask them a question. Well, they can't answer the question because they're not programmed for that.
Right? I get those trickeries all the time.
But they sound, so like this is really a person.
Yep.
You ask them a question and they repeat the first thing they just said. So
That's how you know. Yeah.
yeah.
So, if you could change one misconception about case management among healthcare leaders or other professions, policymakers, or even patients, what would that be? Like, what is the most important thing about case management?
I think case managers are very undervalued, and I would like for the healthcare profession as a whole to recognize what all we can do. We can help patients in the hospital, we can help them as they transition out of the hospital, we can help them in the home setting. We have a lot of resources, a lot of experience, and I think they just need to lean on us a little bit more. Not just Friday afternoon when someone needs to be discharged at 4 o'clock and
Hmm.
be placed in a skilled facility.
Why do you think that's so hard for them to hand over things like that?
I don't know, maybe it's just, they're just not aware.
Yeah. You're a mentor, but it's often said in the nursing and case management, I've heard it 100 times, that you'll eat your own. What do you have to say to people who, instead of mentoring, choose to go the negative route on that?
Well, I've worked with a lot of people like that, especially when I first started in nursing, which was many, many, many years ago. That seemed to be the standard was for the experienced nurses to give the new nurses a really hard time. But I think that the nurse just needs, or the case manager just needs to be aware of what they're doing. You're aware of that they're trying to make it more difficult for you and to maybe work around them or don't ask them questions because they're not going to give you the correct. Go to someone who is supportive and open and willing to help you.
Isn't that crazy that people would just give you the wrong answer or things like that on purpose? Like, they're going to be taking care of you when you're retired. Like, I
Yeah.
don't get it. I don't get it.
Or sometimes they just tell you the directions, but they give them to you like so many steps, when in reality, you could have done 2 or 3 steps,
Right.
but they
Just
wanted you to go, the whole the whole way around.
Well, I mean, I guess sometimes it might, sometimes being mean might be considered as, no, we just want you to know your job. But then other times it's like nefarious.
Well, you can still let people know they need to do their job, but not be mean about it, you know?
Right, right,
You can
right.
be firm, but you still have to be mean. You can still be nice. I think kindness is a major thing that we should be kind to everybody.
Yes. And so finally, I don't want to keep you too long, but after everything you've accomplished, because you're an accomplished writer and speaker right now, why do you feel like it's important for case managers to share their experiences, publish, present, and contribute to the profession?
Well, I think it's very important that we share our experiences because other case managers might be going through the same thing, or they might encounter that in the future. And if they have, like, for example, if you've written a blog about a situation, then maybe that person read that. And when they ran into that situation, they can see what you did, what worked, what didn't work, that will help them in that situation. I feel like I'm giving back to my profession, which has given so much to me. So that's why I like to write and present and do blogs because I'm giving back. But I think a lot of it is also to increase public awareness of what case managers do and also just to provide education to case managers in general about different things. I know I write a lot of blogs on transplants because there's a lot of new things coming out in transplants. There's been xenotransplantation where they take genetically engineered organs from a pig and transplant that into a human. And that's been reasonably effective. One lady had it for several months before the organ failed. Another fellow has had it for several months and seems to still be doing well. And I think people need to be aware of all the changes that are happening. And transplant's very active. There's so much going on. And then also I saw where there was a robotic lung transplant done
Oh, wow.
successfully and
Yeah.
also a robotic kidney transplant recently that was done successfully. So there's so much going on especially in this area that I think it's great to share that information with other people because you may not be doing transplant case management, but if you think about it, most people somehow have a connection with transplant, whether it was their family, their neighbor, someone they knew. Um, when I talk to people, so many people have said transplant has touched their lives. That's important to make sure they're aware of all the new things that are coming out because that's very exciting.
What about the 3D printed organs how far are we out from that?
I think they're working on it, but I haven't seen that that's ever been done yet. But I think they're
That
working.
is an interesting one to watch.
And then the other thing is with, like, stem cell transplants, they're
Yes.
really making major changes with that
Yeah.
and CAR T, therapy, so that's another interesting thing to look at.
We're gonna have to save that for another day. But finally, I wanna ask you, from nursing to national leadership, what inspires you every day, Janet? You're always so happy and so happy-go-lucky and just so sweet. So what inspires you?
I am happy. I'm happy to be alive. I'm happy just to be doing what I'm doing. I'm
I
just
love
a I'm a happy person. What can I say? I'm very
Right?
positive. I like to look at things on a positive aspect. I mean, I'm not always positive.
Well, what
Don't
on those hard days, what inspires you to keep going?
I just keep thinking, this too will pass and I will get through this and then look forward to the next day. I like to think of everything as not rainbows and unicorns, but I like to think that everything is going to be okay. Everything will work out. I may have to work hard at it, but everything will work out.
Right. Well, Janet, we all want to thank you so much for joining us and for sharing both your remarkable professional journey and your insight into transplant and case management. But your career is a powerful reminder that great healthcare isn't just about delivering treatment, it's about coordinating care, empowering patients, building those relationships, and ensuring that no one falls through the cracks during some of those most vulnerable moments of their lives. And we also want to thank you for your continued leadership and for everything that you do to advance the profession of case management. And thanks to you all for listening to The Relay, the podcast of the National Transitions of Care Coalition. To learn more about NTALK, our initiatives, educational resources, and upcoming programs focused on improving transitions of care, be sure to visit our website and subscribe so you never miss an episode. I'm Val Emmons. Thanks for listening, and we'll see you again on The Relay.